Hello, I'm Susan Moore for Spirit of Women and Banner Health. We Spirit members are so fortunate to have such wonderful doctors right here to tell us what's going on, what we need to know to take care of ourselves, our families. And our guest today is Dr. Wolach. He's a urologist. Thank you so much for coming, Dr. Wolach.
Thank you.
So, urology. What is your typical patient, or is there one?
Well, I mean, majority of the people we see obviously are going to be males.
Okay.
They probably make up 60% or more of our practice. But we still see a lot of female urology.
Okay.
And then pediatrics makes up a very small percent, maybe 10% or so.
All right. Well, maybe we should talk about what urology is.
As far as what we treat?
Yeah.
A lot of cancers. Probably the most popular cancer we treat, prostate cancer.
Okay.
Bladder cancer, testis cancer, and kidney cancer. So those are probably the big cancers that we see and treat in our population.
Okay.
Non-cancerous things, kidney stone disease.
Okay, we've got to talk about that.
Okay.
How does a person develop kidney stones?
Well, a lot of different things cause them. The most common thing probably, especially in this region, this area, is dehydration.
Really?
Yeah, this is a big area for stones. Our climate, being at altitude, and very dry climate.
Yes.
People just don't hydrate themselves enough.
Really? That is fascinating.
And probably the second most thing behind that is probably diet. We're seeing more and more stone disease in much younger people, even in the pediatric population, probably because of their diet.
And what are they doing?
Fast food,
oh,
a lot of salt, those kind of things. So this is, Colorado is a big stone belt area. And probably those two big things is diet and hydration probably carry the most. There's other things. There's, people can have medical problems. People with gout are at high risk for stones and other medical problems, but they make up a much smaller percentage than probably diet and hydration. Okay,
so somebody has kidney stones. It ain't pretty getting them out, is it?
Well, I mean, the nice thing now is with technology, which is markedly advanced over the years, we almost never do open surgery anymore for kidney disease. Okay. We've, the lithotripter, which we're fortunate enough, and we're the only hospital in northern Colorado to have one in hospital, is able to treat kidney stones with a sound wave to break them up.
Really?
And then we have a lot of, fancy equipment that we use to retrieve them if they're in the ureter. So, the nice thing about stone disease now is, all of it's done as an outpatient. And people really do very well from the treatments. But the big thing is prevention and preventing people from getting them, because once people form them, they're stone formers, unless they change what caused it in the first place.
That's amazing. Okay, and so how about the prostate health? Is that a big part of your practice?
Yeah, big part of the practice. Obviously, we see a lot of men, prostate health. And there's kind of two areas with that. One, prostate health is just with the urinating symptoms, with enlargement of the prostate. I mean, every male, the prostate enlarges every year. So at some point, they're going to start seeing symptoms.
Okay.
Now, not everybody needs treatment. It's based on their symptoms. But there's a lot of things people can do to help with that. There's some natural products on the market, not really sure scientifically what they do, but there's no harm in doing those. But not sure yet diet-wise with prostate. They're really looking into that, whether that affects it. We're not really sure how that affects it.
You're not going to tell me cheeseburgers.
I'm not going to say it does, but we're not sure.
Okay.
But probably the biggest thing in men's health and prostate is probably the PSA.
Okay, and that is?
That's the blood test that we use for screening for prostate cancer. There's PSA's been in the news, controversy as far as when to do it, who should have it done, when then should they have it done. And that's probably the biggest area where we see a lot of our male patients. From our recommendation, if there's a family history of prostate cancer, the screening should start at age 40, or African Americans. They're at higher risk and they should be starting at 40.
Okay.
With no history, ages 50. And the real controversy becomes is how long we should do it. At what age should we stop checking PSA? And that probably has more controversy than anything because a lot of it is based on overall health.
Gotcha.
I mean, there's some people in their 70s that probably shouldn't have a PSA, but there's some people in their 70s that, you know, are running marathons and doing triathlons. And so those people aren't the same.
Right.
So I think the real take-home message is, you know, not everybody needs a PSA. You really have to look at their overall health, which is a little difficult. What's their overall life expectancy, and try to make an educated decision along with the patient to decide, you know, how long and when we should check them. Because there's also people that are in their mid-60s that probably health-wise are more like their 80s.
Yes.
So you have to look at the whole picture and not just use specific age guidelines.
But would there be something that if they did need to have this test, is there something that might trigger a man to say, I think I need to get this checked?
The only thing that does that is their wife or spouse.
Isn't that the truth?
It is.
Men, try to get a man to the doctor is just tough.
Yeah, it's very, very difficult. And, you know, most of the time that we see the patients, they've gone in to see their primary care physician, or they've gone to a health fair, or one of those, and they have blood drawn, and that promotes it. Because, you know, we know PSA is not a very good test for screening. We've known that for a long time. But prostate cancer doesn't have symptoms. That's the problem. It gives absolutely no symptoms. And so your only test is to have the exam done plus the PSA. And so most men usually don't go to the physician, you know, unless they have something wrong with them. They feel something. Where with prostate cancer, you don't have that. You don't get any symptoms from it.
Well, the pressure is on all of us wives to keep the husbands coming to see you.
So we will blame you then.
Okay.
For the men not coming. Yeah.
Okay. Well, Dr. Wolach, thank you so much for talking to us about urology. We appreciate that.
Appreciate it. Thanks for having me.
I'm Susan Moore for Spirit of Women and Banner Health.